వెల్కమ్ బ్యాక్ టు నవ్య. గుడ్లు, చికెన్, పాల ఉత్పత్తులు వంటివి ఆహారంలో ఉండేలాగా జాగ్రత్త పడాలి. ముఖ్యంగా కోడిగుడ్డులోని తెల్లసొన జీవ ప్రక్రియల రేటును పెంపొందిస్తుంది. ఉదయాన్నే తెల్లసొనతో మిరియాల పొడి కలిపివేసి ఆమ్లెట్లోని అమినో యాసిడ్స్, కాపోసైసిస్ రోజంతా జీవక్రియను వేగవంతం చేస్తాయి. హార్మోన్ల అసమతుల్యతను అదుపులో ఉంచుతాయి. గ్రీన్ టీలోని బయో యాక్టివ్ పదార్థాలైన కెఫైన్ వంటివి జీవక్రియల రేటును పెంచుతాయి. అధిక బరువును తగ్గించడానికి దోహదపడతాయి. వీటితో పాటు నెయ్యితో సహా ప్రోబయాటిక్స్, మంచి బ్యాక్టీరియా పుష్కలంగా ఉండే పాలు, పెరుగును ఆహారంలో చేర్చుకోవటం మంచిది. ఇప్పుడు నవ్యలో సక్సెస్ స్టోరీ చూద్దాం.
Hi, I'm Kanika Bansal and I'm a biomedical engineer. I did my masters from University of Edinburgh in UK. After that, I did a fellowship with Royal Society of Edinburgh, and then I worked with NHS, which is the National Health Scheme in UK, and I would be involved in developing new medical products by shadowing the doctors and suggesting what kind of products would fit for the healthcare system over there. In 2021, we decided to move back to India and start our company here in India to help the rural and Indian population. So these are our current products right now, where we are starting off with core body temperature as the first biomarker. After this, we'll be adding more vital sensors into our product, where it can add more value for the patients and also the healthcare system alike. Any person who is not in the hospital, like discharged, perhaps patient discharged, they can put this device on the skin, like on the chest or near the armpit, and then this device will keep tracking the core body temperature over a period of time, and it will also give the alerts if person is undergoing hypothermia, where the body temperature becomes too low, or if a person is getting any kind of heat stress. Apart from that, we can also do different disease detections, like we can do a sleep analysis of a person and say what is the right zone where the body sleeps and when the body wakes up, so the person can sleep at the appropriate zone and feel more fresh when they wake up. This data can also be used by doctors who are analyzing the sleep patterns of patients and help them improve the sleep cycles. In our app, you can see there are a lot of modules we have given, the disease modules, and it is particularly very useful for women, because we found one issue with a lot of women are facing these days, which is about the menstruation cycle. So our menstruation cycle, as per the ideal scenario, it is supposed to be 28 days, but in general it is not the case. People can have anything which is ranging from 35 days to 25 days also. It could be 45 days. With this product, we can analyze what is the actual cycle the body follows, and for this we need to keep this device on the body for 3 months. Once the 3 months data comes, we can say that this is the cycle of a woman, and if it's a normal cycle, then they don't need to worry about anything. It can also talk about like ovulation, like what state, what is the right time for them to conceive. This is called NV-Core. In this one, the probe is this small with this blue part, which gets attached to the patient, and this device can be kept away from the patient at some distance, where we can show the temperature of the patient to the doctors. So if a doctor is coming on a round, they can quickly see the temperature. With a button on the side, they can quickly change the temperature reading to F or C. They can set alarms in this, and the whole data from this device gets on to the screen for the doctor. So it gets transmitted via Bluetooth, and then the doctor get the whole report of the patient on their phone app, so they can see the whole data, they can see the charts coming there, and through our app they can also see which patient is in a emergency condition. we are helping actually women from the stage of their menstruation cycle till the stage where the baby is born, and then even on the newborn baby they can use this product. Hypothermia is basically the body temperature becomes too low, and even in summers the body can become very cold for the small baby, which is a newborn baby. So the first month for the baby is very crucial for the survival. So with this product we not just tell the parents that the baby is undergoing hypothermia, we also tell them the steps they can follow now. So for example, in hypothermia the treatment is very simple. You just need to warm the baby. So you apply more blankets or more layers on the baby when the baby is undergoing hypothermia. The second step they have to do is a kangaroo care, where the mother puts the baby on their chest and gives them skin to skin touch. In pregnancy, if a woman's temperature increases during the first trimester, the chances of miscarriage increases drastically. So with every degree rise in temperature, even in the environment, can cause up to 22% higher risk of miscarriage. So that is also something which a doctor can use for prediction. Our vision is to make sure that we are able to bring such products in the market which can help the user and connect them from rural India to urban India, and also create a preventive ecosystem where the doctors have the tool to take quick action and can effectively help save lives.
చూసారు కదా సక్సెస్ స్టోరీ. ఉపవాసం పేరుతో రోజంతా ఆహారం తీసుకోకపోవడంతో జీవక్రియలు ప్రభావితమవుతాయి. కనీసం 5 గంటల్లోపు ఆహారాన్ని తీసుకోవాలి. రోజుకి కనీసం 7 గ్లాసుల నీళ్లు తాగాలి. డీహైడ్రేషన్కు గురైతే జీవక్రియల రేటు తగ్గుతుంది. అలాగే రోజుకి 7 గంటల నిద్ర అత్యవసరం. ఇక ఇది ఇవాల్టి నవ్య. తిరిగి రేపటి నవ్యాలో మళ్ళీ కలుద్దాం. అంతవరకు సెలవు. నమస్కారం.
Anchors Dress Courtesy by KLM Fashion, Amirpet.